Okay. Introductions?
Absolutely. Let's do introductions.
Start right over there.
I'm Hardy Page, Town of Windsor Police.
Okay.
I'm Sylvie Santiago, New Windsor Town Council.
Hi, my name is Syria Perez. I am the building principal at North Safety Academy here in New Windsor.
Robert Doss, New Windsor's Police Chief.
George Myers, Town Supervisor.
John O'Malley, I'm a resident in the west end of town.
Just got one person on there, Patrick?
And Tammy.
Is that me? Hi, everybody. You all look so small. My name's Tammy Ryan, and I'm glad to be a part of the discussion tonight. I work for the Department of Mental Health for the county. I oversee adult mental health and chemical dependency and serve as a lead for the crisis intervention work that we do in the county. So glad to be here.
All right. Okay, so we left off in the last meeting. We did a lot of talking about the crisis intervention team and the mental health situation here in the town and really across the state and across the country. But I'll give a quick summary of where we left off from last meeting. We talked about the review of the 2021 crisis intervention team here in New Windsor. I'll just recite a couple of the statistics as far as they go from 2021 last year. We responded to 298 calls where there was mental health crisis occurring. The officers do a special report for that, as we know. As part of that, there was a voluntary transport to the hospital by the police officers 124 times. That's again with 2 police officers and the subject that's needing treatment. There were 33 other cases where the police officers had orders from the county to take people into custody and bring them to the hospital for mental health concerns. And there was 23 other instances where we actually took somebody into custody because they were a threat to themselves or others and brought them to the hospital. There were 10 instances where force had to be used, which is only 3% of those occasions. We'll get into the use of force reports later on in a different topic, but that's interesting. When there's 298 people in crisis going through a lot in their lives and potentially suicidal or threat to others, we only had to use force in 3% of those encounters. So I think that's worth noteworthy. So that kind of sums up where we left off. So the concern from the panel, and certainly myself, was the amount of calls that were going on. And not only that, the amount of transports that the police department is doing. And the repeat contacts was another topic, if everybody remembers, that we were talking about. And the panel was given, the same list that the county was given the other day in a meeting, as far as how many individuals we encountered on more than one occasion. Some of those individuals, there was about 44 people last year that we encountered more than one, and some of those had as many encounters as 10 times. So we kind of spoke as a panel about several different topics, but one of those was, we're hopeful that those individuals can receive treatment where they don't need to have the police come several times. And then we also talked about police officer safety and having to respond to that many calls. We don't want to have one of our police officers injured either. So that's where we left off. So let's pick up where we are today. Dr. Ruback, she's part of the panel. I don't see her here from St. Christopher's. So St. Christopher's, they had a female residential campus down on 94 in Windsor, where we would respond to several times a month, which is subsequently closed. So in theory, our number should have went down, right? So they've been closed now for a month or two. But unfortunately, I'll just talk about the previous month because the statistics are in for March. It was our busiest month in the history of the CIT program, with 35 calls just in March alone. Some of them were repeat contacts as well, and that's all noted in the report. So that's where we left off. So just bring up the year-to-date, 82 CIT reports year-to-date at the end of March. So again, that's not counting April. I know one day I was talking to Sergeant Sylvester, the coordinator of the CIT program, and it was only in the afternoon, and we were up to 4 reports in that one day. So we have our days. Again, these aren't all evenly spread out, right? We all know that. So 82 reports so far this year. So in the meantime, we left off saying that I was potentially going to write a letter to the county about our concern. Shortly after our meeting as a panel, I had a meeting with the Orange County Police Chiefs Association, and that topic came up. So I volunteered to be on the committee for the Orange County Police Chiefs as their representation of not only New Windsor, but every police agency that's involved in the CIP program, to go forth and meet with the counties and try to work on some of these concerns and issues. So that definitely was a step in the right direction. So now I'm involved in that on the county level. So on April 4th, I had a meeting with Tammy, who's here with us today, and Darcy Miller, who's the Commissioner of Orange County Mental Health. I brought up a lot of the concerns. I'll point out a couple of key points that I thought were definitely steps in the right direction. It was a very good meeting, definitely got a lot accomplished. The county was definitely open and very receptive to hearing the concerns of not only New Windsor, but the other police departments in the county. So I definitely give them credit. They did a good job in listening to us, and they're going to be working on some things. So it was interesting to me. I learned that, because we really don't know. So I asked, like, where does New Windsor rank in the county as far as CIP and reports, right? So we probably should know that. Well, I was told, depending on the month, and it goes back and forth month to month, but we're as busy as the city of Newburgh. Basically, we're the #1 position in city of Newburgh. So depending on the month, but we are extremely, extremely busy in contrast to even other agencies, other cities within the county. So keep that in mind as we talk about this. We're extremely busy. One of the other concerns I brought up is, so our and other agencies are having this issue too, with contacting the same individual multiple times. We were hopeful that, the purpose of this is nobody falls through the cracks. We're doing the reports, we're getting them help at the time that we're responding, and hoping that mental health is following up. So we kind of talked about that, and there really wasn't a good look. So I asked, if a person has, let's say, 3 contacts in a month from a police department, is that looked at a higher level within the county than what's being looked at now? And it wasn't, but what they were looking to do is have something, let's set something up in place where if we do have those 3 reports, let's have a higher up supervisor review this case on a different level and maybe see if there's a solution that could happen. So collectively, I think we're all going to start working to have that start happening in the county. So I'll get more information at our next meeting, which is not planned yet, but that's coming up. So getting that second look and that higher up look, the more experienced person or maybe more authority person, I think is definitely going to benefit us and hopefully reducing those calls, multiple calls for the same person. I also spoke to them about exploring a partnership with Orange County Mental Health and the Orange County Sheriff's Office. We talked about that not only on the initial response, having somebody from mental health and say a sheriff's deputy or somebody like that, maybe plain clothes, maybe uniform, that wouldn't be up to anybody but the sheriff, or have them respond after we calm the situation down, have them respond, mental health and the sheriffs, to do the transport for us, to take that off. And that was something that the police chiefs definitely were interested in. And I guess they have done some talks with the sheriff's office, but there's been no progress or give in that regard. So that was where that stands. That's really all we could say in that matter. It's really on the sheriff's office to decide whether they want to step up to do that or not. But they have had discussions with them at some level. We spoke about the possibility of having somebody here like we do with Fearless, who's embedded in the police department on a daily basis or at least several times a week to follow up on mental health calls. There's really no personnel. Actually, the county is short personnel in the mental health area. And I think Tammy will probably speak to that. Difficult, we have to hire somebody. And the typical cost to hire somebody to be here, if it was on a full-time basis, you're talking $75,000 to $100,000. So Councilwoman Santiago, I know we talked about grants. So that would be our number if we were to try to go ahead with a grant to try to shoot for, if we were to get somebody full-time. And then obviously part-time would be less, but something for the panel to consider, to have that person here or even be able to respond out with us. Another thing we talked about was the ability of the county to track contacts. So we had an individual up at the airport, I'll briefly give you a breakdown, had some mental health issues up on the airport. The state police were dealing with them in the terminal. When the individual left the terminal, went on to town property, we were dealing with them. And they were also being dealt with back in the city of Newburgh, where they reside. They were homeless, but where they resided over there. So you have 3 different jurisdictions, 3 different police departments dealing with the same individual. And who's tracking that, right? We know we dealt with that person this many times, but we may not know the state police did. We may not know the city of Newburgh did. So does the county know? So they're gonna work on, I guess, bringing that information better, and I think it's a computer, system that needs to perhaps maybe work better or have better contacts. Like when we give them the summary at the end of the month, it says each person we contacted multiple times, so they get the information from us, but it doesn't include other people. So they need to put all that information together. We may have only contacted the person once, but Newburgh had 3 times. Who's looking at that to try to get this person help? So they got to connect those dots. Garnet is one of our biggest issues with bringing people to Garnet. They're getting turned right around and put back out. I spoke to the panel last time about an individual who was suicidal, was a Marine, and sat there for upwards of 20 hours and ended up walking out of the hospital because he got no help. And then it became New Windsor PD's problem because he lived in New Windsor, and now they wanted us to find him. Well, maybe they should have helped him. So I guess Garnet is coming together with a CIT work group as we speak, hopefully even this month. So maybe we'll see some progress there if they start listening to these concerns. And again, not in defense of Garnet, but, you know, their staff is very busy. They only have limited beds. So it's many steps in this problem here. Hopefully, we're hoping to talk to Garnet a little closer because we're bringing a lot of people out there, just like all the other agencies in the county. And the last thing that I spoke to them about, at least the highlight that I'll mention, is feedback. So this is a system that we're giving a lot of data over to the county and other agencies as well with the email chain that we send in these forms to. Data in, data in, data in. We don't really get anything back. So that kind of hurts when it comes to the officers because they don't have feedback. They're doing all this work in and doing this extra work with the forms, and they're going back multiple times to the same individuals. They never get an update of what's going on. Is the county working on it? What's the status? Trying to get the county to provide us more feedback in our direction. But I'm sure there are many success stories. These police officers need to hear these success stories. They don't hear anything. So I think that would definitely be beneficial. That was met well with good light with the county as well. So hopeful for that. So that's where we stood after that meeting, and that kind of brings us up to date. I thank Tammy Ryan for being here. I appreciate it. And that was on the commissioner. I just asked her, and she said, absolutely, we'll have somebody there, not a problem. We might even have multiple people. So they're always welcome to come to our meetings and talk, and they're always receptive to the police department hearing our concerns. So Tammy, if you'd like to say anything?
Sure, and you did a wonderful summary. I'm diligently taking notes and remembering the conversation that we have. And thanks again, everybody, for having us. You know, on behalf of Darcy, our commissioner, she would have been here tonight as well. She happens to be at a conference upstate. That's a mandatory thing every year for her counterparts. So I apologize on behalf of her, but certainly bring her sentiments. A couple of things that come to mind, you know, the data piece. Let me just talk a little bit about that, which wraps into the reports. And Chief, just so you know, we did go back and look at those 44 individuals, so I can speak a little bit broadly about some of those numbers. And, you know, I want to start and end right on a very positive thing. When you shared with us and, you know, we talked about a success story, we were absolutely like, yes, we need to be able to share those moments. We need it even clinically on our side of the fence when we're providing services. And one of the things that we do weekly is we meet with our Orange County Crisis Call Center that is staffed by contractual agency partners. And we review CIT reports I see them every day. I read every single one, but we review them weekly together. We look at the numbers. We look at high-risk case that we know about. One of the things that, you know, certainly came to light in recent years since we opened the call center was how much data we realized was out there that we didn't necessarily have access to. And similar, you know, with the tables reversed, because we're bound by HIPAA. So it makes it really difficult, you know, as some of you know, and certainly the chief knows, for us to be able to write back or call back and say, you know, yes, we brought Tammy Ryan in, she was hospitalized and this happened. So one of the things we were talking about or trying to explore was a memorandum of understanding with each police department that has CIT in place. So that's something that's got to go through the county process, but we're looking into that to see if we can do that. We wouldn't be sharing, you know, whole clinical charts. That's just not ethical. But what we would be able to do is more than what I usually say to officers and to CIT coordinators like Sergeant Sylvester is, you should get a thank you from me every single time, which means I'm in receipt of the report as your point person. But there is a small group of us about 8 to 10 people that receive those reports that work in different capacities. We then come together to look at some of the data we have access to say, where is this person? Are they already getting services? Are they not getting services? Have they had repeat reports? Sometimes we have that data, sometimes we don't. And there are different reasons that factor into that. I'll give you one example. When people are on Medicaid, because of my role or Darcy's role as what we call the local government unit, we have access, to looking at Medicaid billing data. That is very, very helpful for us with the Office of Mental Health. We can tell if somebody has been in the hospital 3 times, if they've been, in our hospital or even in another county, which is one of the barriers that we talked about with you, Chief, when somebody crosses county lines, right? So we get a little bit of information, but we rely so heavily on relationships and being able to, coordinate care that we know our partners and our providers really well. We don't have those same kind of relationships, and we don't have the leverage outside of our county because our jurisdiction is only Orange County. So I know that, let me just talk about the numbers because Chief talked about the 44 repeat CIT reports. A couple of things that we realized, and this is not hardcore data. We pulled this from the notes and from different pieces of what they call the CAD system, which is at the Emergency Operations Center. I should have asked, I made an assumption, so I apologize, but are you all familiar with the Orange County Crisis Call Center?
No,
I
not
see. No, not everybody. Okay. So just kind of a quick backstory. We opened the doors to the Orange County Crisis Call Center April 2019. It's hard to believe it's been 3 years. At the time, we actually met with the police chiefs and the district attorney office to take a look at our system to say, we know things aren't working the way we want it to. What can we do? What's your feedback? One of the key pieces of feedback at the time from the president of the Chiefs Association was, you need to really keep it simple for us. You need to give us one number. We don't have the resources to, transport people all over the county. Similar, challenges that the chief has mentioned tonight and that you've been talking about. And it really kind of gave way to us doing some research over the next year. And so that was back in 2018. We looked across the US for models of co-located behavioral health staff and law enforcement and all different versions of that. And I'm sure that throughout your conversations of police reform, you've heard different types of models shared. What we found, and something we had always been interested in, is having our mobile response team and those clinical staff co-located where the 911 center is in Orange County. And we were really kind of gung-ho about that. We only found one model in the US that happened to be in the state of Texas at the time that had something similar. So I share that with you because we really kind of forged our own way and we're still learning as we go. For instance, we might be licensed clinicians, but we're not, electronic experts or data experts. So it's awesome. We have this great co-located model that we were able to work with the Emergency Operations Center on, where they are located on the same floor as the 911 operators, fire, EMS, police. We have multiple pods, as they call it, where our clinicians will answer the phone, triage the call, and then do a handoff as needed, either to what you're familiar with as a mobile response, or a peer, and I'll talk a little bit about that, or supportive listening or following up, things like that. One of the things that we've learned over the last 3 years is that 911 was not able to share addresses or even data with us, even though they're sitting elbow to elbow, because of some of the laws that govern 911. So that's taken some time to work through, and it sounds like a small thing, but it's been a big glitch when you think our time response, right? We need to be able to respond to people as soon as possible. We're never going to respond like police or EMS, but our goal is always to respond within 24 to 48 hours, if not within the same, time frame. The way that we do that, typically the best case scenario is if police are called to a scene or if police are not involved, we get a call through 311, which is our call center. And we then figure out if the mobile team needs to go out, or if we can help de-escalate a situation on the phone, or if we can send out a peer. We kind of triage, as I said, to figure out what's needed in that moment. So part of the lift has been for the last 3 years, educating everybody on the use of 311. You can also call an 800 number, and that 800 number has been the same number that we've used in the county for over 20 years for the mobile mental health team, which I'm now referring to as the mobile response team. So that's just a little bit about the structure and what it looks like there. They're in Goshen. That's where the EOC is. We don't necessarily publicize that to the whole public. We don't want people showing up at the Emergency Operations Center per se that are in crisis. You know, it's not designed for people to come to them. It's designed for the teams to go out into the community. So the key service, and again, the chief has mentioned this a couple times, is our mobile response team. We've had a contract with a local provider, Access Supports for Living, for about 30 years. We've been providing some kind of mobile service. We've been doing that 24/7 for about 20 years. Some counties don't have mobile at all. Some counties do it part-time. We've also been providing peer services that either go in tandem with mobile or go in lieu of mobile if they don't need a clinician. And peers are people that have lived experience either with mental health or substance abuse issues that are doing well in some form of recovery and stable. They offer a different ability to engage somebody, maybe when somebody's not willing to go to treatment, but they don't necessarily rise to the level of a hospitalization. So it's kind of our go-to when we're struggling to engage folks because they can engage them differently. So that's a little bit about the call center. Let me just take a pause there before I keep rattling on and ask if you have any questions about the call center itself. No? Okay. So back to the data conversation. We're constantly looking at how we collect data, how we pull data out. One of the things, you know, we're constantly looking at how we leverage funds to do what we do, similar to the conversation we're having here tonight about grants, or not just county funding, but what's available state and federally. In the past, and one of the things that we've done recently was able to leverage some funding from Aileen Gunther's office and from her, and she's done this for us before in the county. The problem is that her particular catchment area doesn't include New Windsor, right? But I'm just using that as one example because this is an avenue I think that's very helpful for all of you to know. And Aileen Gunther has funded other initiatives for us. It's one-time funding for 2 years. Sometimes we can roll it over to 3, but it helps us kind of kickstart some of the initiatives. So with some of the stuff that you're talking about now, this is recent funding that we got into the county that we're going to be able to augment some of these mobile response services or peer services, for instance, in the town of Walk Hill up through Port Jervis area, because that's her catchment area. Yeah. So as far as numbers go, I will say, and I just want to share this with you. I would say don't try to memorize this, but I want to share what I found by looking at those 44 unique individuals was that out of the 44, 3 of the individuals had multiple incidences in one day, which is a small number, but I think that's open for discussion because and certainly the chief and his staff would, you know, attest to this. Sometimes you're dealing with an individual, even the individual at the airport, multiple times in one day, right? Because the situation is not de-escalated, for lack of a better word, the first time. So when we look at those situations, we don't necessarily count them as multiple CIT reports. I'll give you just one quick example. An individual that you had dealt with earlier in the morning came into the station later in the day to thank officers for supporting her earlier in the day, and they counted that as 2 CIT reports. So there's a little bit of that happens with the reporting. There's a little bit of duplication, not a lot, but a little bit. I would say that 90%, over 90% of those calls out of the 44 were referred to peer services. What I can't tell you is how engaged they were, right? So they were referred. And one of the things that I say to CIT coordinators is absolutely every CIT report that comes in, we look at, we read, and we check against whatever information we have to see if they're connected. Oftentimes they may not need mobile going out, which are clinicians, and that's where the peers come in. So when you see a high number like that, that says to me that most of the folks qualified for a peer referral, which is helpful information. However, in tandem, over 50%, about 51%, also received a referral to mobile response team. What does that mean? So a lot of times mobile will come out with the police if they're available. Sometimes police handle a situation before mobile can get on scene, and they will put a call into 311 and say, can you follow up? Can you do what? Or mobile will help assess on the phone. We've had a little bit of flexibility there because of COVID, being able to do telephonic stuff. So there's a couple of different ways that can happen, but at least 50% are being referred for clinical evaluation as well. We also found that about 44% already had services in place. That's helpful information for us, because when we learn that somebody is struggling in the community, but they have some kind of treatment provider in place, the question that comes to our mind is what's not working, right? Are they making their appointments? Are they making and participating in treatment, whatever that looks like for an individual? For your community, correct me if I'm wrong, but I believe that you have community residences in your community that serve different populations. So for instance, individuals with either intellectual disabilities or developmental disabilities. Am I correct on that?
Yes.
Yeah. So not only did you have St. Christopher's, you have another high-risk group of individuals who often will struggle with behavioral issues. And that's just one example. I mean, New Windsor is not the only one, but certainly one of the ones that has a more concentrated area, which is going to give rise to some of those higher numbers. You also are reporting to us when you respond to a non-fatal overdose. I don't think it's a surprise probably to you that we've been dealing with an epidemic for many years related to opioids. We do some dedicated outreach and follow-up for that. We do a lot of it, actually. And one of the ways that we do it is when police inform us, and they can also do that on a CIT report. New Windsor is one of the ones that does that. We do that in tandem with other partners. We then send out a peer within 24 to 48 hours that goes out with a bunch of resources kind of in an outreach bag and says, you know, now that the police have gone and things have died down, are you ready for help, basically? And we'll get you help like right now in real time. The other one I wanted to share with you statistically, because I know Garnet is one of the challenges, that what we learned by looking at these 44 people is that at least 31% had at least one hospitalization. So these were not individuals that were just referred to the ED. It means by history, the individuals had at least one hospitalization related to some kind of mental health crisis. So it might sound a little like in another language for you. For us, this is very helpful. The more that we drill down with officers and we look at where some of the glitches are, honestly, I probably should share, we had about 8 or 9%, maybe closer to 7 actually. Yeah, between 7 and 8% of the 41 that we were not able to contact because of incorrect phone numbers, addresses, moving, homelessness, they're transient. I can think of a couple of individuals that we've worked with your officers on to try and pre-plan, you know, mobile coming to the scene versus when a crisis is happening, because they're actually homeless, and trying to find those individuals is very difficult sometimes. So that's, you know, a smaller but another barrier at times. We don't really have a number where we say we stop reaching out, but when we've called or mobile's gone out 2, 3, 4 times, you know, at that point they go on a separate list where we're still trying to follow up, but they're not getting, we have no way to contact them until they land someplace else. And unfortunately, you know, for you guys, because Newburgh and New Windsor tend to be the busiest in the county, a lot of those people can be transient between the two communities. So I think as we look at data, it would be helpful, certainly, absolutely, with police input, because I have a feeling that you probably have more data that we can take advantage of, I'll say. It's a matter of how do we pull it, right? In our system, we have a number of different quote databases. When people go, similar to when you go to your primary care doctor, that's all protected health information. In the behavioral health world, it has different levels of confidentiality, which make it more complicated in pulling some of that information and being able to cross-reference, you know, who's where. what we have access to sometimes is people that have Medicaid, but that's not always the case, right? It's about 80% of who we typically deal with in the public system. About 20% has private insurance, and that gets a little bit more complicated. What do I want to say? Just as a FYI, right now we have about 9, I think it's 10 departments participating in what we call the CIT process. New Windsor came on in the very beginning, right after, I mean, one of the previous chiefs was really the biggest champion and was key in bringing and helping us bring CIT to the community. And CIT is really a model about increasing officer safety as well as citizen safety, but it's also about the partnership between mental health and law enforcement, right? Those referrals, when I talk about, 90% of referrals have been made, that's really incredible, because you certainly have officers, and Sergeant Sylvester is one of them, that will, I can think of one story where he called me one day and he said, listen, I didn't do a CIT on this person, but we know she's been struggling. And I saw her at the gas station and I stopped to ask if she needed help. I mean, it's, I don't know if that's considered community policing, but it certainly was heartfelt. Got her on the phone with 311. And those kind of proactive situations are really what we're striving for when we can, to try and lower the amount of time that officers have to respond to somebody in crisis, or that we do. Chief Dosh, you talked about the sheriff's department. Yeah, they don't really want to hear that from us. That, they should transport, or they should be more involved in this process. They're certainly willing to be trained and to be up to speed on the CIT model, but there is some, I don't know, fragmented in how that looks countywide. So we rely heavily on the local police jurisdictions for those reasons. I know you shared a couple of statistics right at the beginning, and you may have said this, but I just wanted to reiterate that one of the things, and it might have been this board, I think, Chief, you had shared with us, I think you did say it, that there was a decline from 20 to 21 in the amount of transports by about 16%. But simultaneously, there was an increase of about 12% of referrals. That's really good news, because that says to us that we collectively are working closer together, and that more referrals are being made through 311 or some way, versus having to respond every time. I think one of the goals that we have is that officers across the board use 311 for every single time they are interacting with somebody that's having a crisis, or proactively. Because that's the handoff to us. If you respond to somebody, and this is one of the things that we learned, we don't know that until we see a report, or until it rises to the level, for instance, of the gentleman at the airport, and then Darcy or one of us typically get the call. So that's the kind of stuff I think we're collectively still working on. The MOU potentially would help with some of the sharing of information. I think pushing and promoting how often officers use 311 is a key piece. And honestly, New Windsor probably does one of the best jobs of it. And I'm not just saying that, it's true. Completing reports so that all data is as accurate and up to date as possible. Some of those smaller strategies will help increase some of our ability to follow up. And I'm going to take a pause there and ask if anybody has any comments or questions.
I just wanted to add one thing just quickly in reference to the duplicate reports. I don't know about the instance where the person came into the lobby, but I definitely have my staff filling out anytime they contact that individual to do another form, because I don't want there to be an occasion where, oh, we didn't know. Oh, we didn't know. We're documenting everything and sending it along. So there's never going to be excuse. Nobody knew, because we're doing our job here.
Yeah.
And I don't know, again, I don't know what that specific incident. So yeah, absolutely. If we deal with a person in the morning, at lunchtime, and at dinner time, we're doing 3 reports.
Yeah.
That's the way it's supposed to work. So just to clarify that for anybody listening.
Okay. I would say that if you're still responding in the second and third time, something broke down in the first time, like between us, and that's, I think, just my point, whether 311 wasn't called, mobile couldn't get out there, they got to the hospital, they weren't admitted, they should have been. There's, I know, multiple reasons for that. And the hospital is one challenge. But what I will say as a general, and this is not specific to mobile, or excuse me, to New Windsor, I've been the lead for us in our department since we started this in 2014. So we've been doing this for about 7 years, right? And what I continue to learn, and this was pre the call center, was even when we were just dispatching mobile, that oftentimes officers would voluntarily transport somebody without calling mobile. So that leads to a couple of discussions for us. Because we do get data from the hospital too, and I certainly could debate, and we do this a lot. We will call the hospital administration and we will advocate and argue on behalf of some clients we absolutely feel should be admitted, especially if we're getting calls directly from police and we're hearing all these details of potential violence, safety issues for them or others in the community. Many times people get to the hospital and they can present in a whole different light. You know, they're calm, they're collective, they're appropriate. They don't show signs of, you know, behavioral disruption. And the doctor that's assessing them in the moment says, I have no reason to admit them against their will. That's a challenge we all deal with all the time. So one of the things that we've been looking at, you know, diligently is out of those voluntaries, I keep saying, are you calling 311? Every time you voluntary transport, are you calling 311? Because if you're going to bring them to the hospital because you think they need to be admitted, we may be able to triage that before you go through all that. And I know that time is probably the biggest issue for officers and many people being short-staffed, but it's a little bit about investment on the front. If they spend the extra time either waiting for mobile to get there or mobile becomes aware, then we can do the follow-up. And most of the time we can tell you if somebody's going to be admitted or not. Or we know that we've been dealing with the person 3 or 4 times in the course of a very short period of time. The other thing I was just going to comment on, because Chief, you talked about pickup orders, which I wasn't even thinking about that. And I forget the number that you shared. It was 33, I believe, pickup orders that you did.
Yes.
So for those of you that don't know what that is, we have in the county, the highest level of outpatient care is where somebody can potentially be mandated to services. It's a very small percentage of individuals, but these typically, and I hate to say this, but these are the cases that you see on the news. These are the very high profile ones. We strive to not hit the news and to, you know, do a good job before that. But these are court ordered individuals that are mandated to some kind of treatment, typically when they're not adhering to medication requirements. So at any given time, we have what we call an AOT list that's based after the state law, assisted outpatient treatment. And we have a forensic coordinator that oversees that. So those pickup orders is when she's working with the judge and she might call a local police station to say, we need Tammy Ryan picked up on a pickup order. She didn't present to treatment. And then the judge orders a pickup order, basically a warrant for them, for her. And they will be brought in, prescribed, given the medication that they didn't get. It doesn't mean they're going to be admitted inpatient. It means they will have to go and get either medication or attend treatment that day, because it very well could be outpatient treatment they're going to. If they're that violent, they obviously shouldn't be in the community. So, but we do have that. That is a state law. It happens in every county. You have somebody like that that oversees that. It typically runs through our office or an office like ours, and those are what the pickup orders are. So yeah, I'm doing a lot of talking. I know this is a big conversation for most communities. I think that New Windsor is probably in tandem. Most departments, I've sat in on a number of different jurisdictions when they were doing their planning for police reform, very similar conversations when it comes to mental health crisis and how do we respond differently or how do we respond better, more efficiently. Talk a little bit about peers, because the chief talked about, you know, potentially having something like that within New Windsor. Just in the last 2 weeks, I've gotten a couple of notices about funding that's available either federally, for instance, to the Bureau of Justice. And we've actually received funding from there before, where we have started programs very similar to this. So that's an example of a funding resource that might be something you'd be interested in. We're always looking to see how we can augment services. We'd love to be able to, you know, fund a peer or some kind of additional support that would support every police department. But as you know, we have over 30 police departments in the county and, locally. So it's very hard to do that fiscally. Sometimes we can fund a peer that will be shared between two departments or two different services. We've done that before. The funding that we got from Aileen Gunther recently is actually going to allow us to have peers shared between Town of Walk Hill, Middletown, and Mount Hope, if they want to take advantage of it. And partly in Port Jervis. We already have some services in Port Jervis. So that's something else to consider. I always send, Sergeant Sylvester participates in our CIT committee, which is co-chaired by me and Chief Pieri from the town of Highland, who you may be familiar with, some of you. He's, from New Windsor. He used to be the police academy director there for a long time. But Sergeant Sylvester, along with the other members of the committee, will receive notices from me on either funding notices or changes in the protocol or updates on email lists or updates on processes. It helps us just kind of build on that rapport with each other. One of the things that we do when we meet is we share new services, new partners, get to know each other. Some examples of things that have worked really well is where we've seen officers pick up the phone and just say, I've got this individual here. You have a couple of them, like I said, in your area. I know they're usually struggling, but today it's higher than normal. So they're, again, more proactive. And it's in downtime when it's not a crisis and pulling from other resources and stuff like that. So it's a work in progress.
All right, let's see if we have any comments from the panel.
Listen, I have a couple of comments here.
Yeah.
That New Windsor is number 1 or 2, and Newburgh is either 1 or 2. So what I would propose that we try to get Newburgh and the county to take 1/3 of the cost. I'll take the other 1/3 of the cost, and we get us a full-time person over here.
For a peer, sir?
Whatever it is that we need help,
Mhm.
all of the things we're talking about,
Mm-hmm.
guarantee to you, sooner than later, one of these people is going to get hurt. One of these individuals is going to get hurt very badly, or one of my officers is going to get hurt. And one way or the other is not going to bode well for the officer. And I'm very concerned about that. Anytime you want, you can tune into the news and you watch a mother on TV crying, saying, people know that he needed help. I've sent them so many times, and now look at him. Now he's dead. So that's going to happen here. It's just a matter of time. And you have a lot of statistics that bear fruit to that.
Mm-hmm.
So I think that we would be willing to pay 1/3 of that cost, maybe do it for a year, see if it works out. But I think that would be a step in the right direction. Actually, we will make room here. As the chief said, we had someone from Fearless here. I think they're still around, and that worked out well for us. We had them right in-house, and whatever they needed, we made sure that they got it. And we would do that here. If we would get somebody that we would share the cost with, I think the county should pony up some money. I mean, yeah, much more resources than I had, but one of the council persons here with me tonight, and she's always been concerned about this mental health issue. I'm very concerned about, we talked about this guy at the airport, but what everybody left out, he's naked. This guy's naked at a school where I have special needs children.
Mm-hmm.
They were really, really worked up over there. And then we kind of sent them out to where we went, and I find out that he was also naked at the Marine Barracks. So that's really not a good sign. Something's going to happen. And I'm not sure if it happened again, but I'm pretty sure when they did get done with him, they sent him by Uber back to the airport. I don't know why. I think the troopers found him wandering around the airport. So if we had someone here that maybe could get involved right away and would know who to call there. I mean, listen, I understand the warehousing, but that's just called a problem. This is all over the country. In particular, I'm just concerned about New Windsor. But if we're that high, then we would be willing to pony up some resources to get somebody here. And I think that's part of the problem. You talked about police officer with time transporting people. Not so much the time, it's I'm losing that police officer to patrol where he or she should be when they're jackassing people all over the county. And that's not their job. Now, if I was Steve Newhouse, I would drag the sheriff in and say, listen, I do control your budget. So here's what I want you to do. But politically, maybe someone needs a little courage to do that. But these local departments do not have the manpower nor the time to do that. And when they do that, that particular officer is gone from the community.
Mhm.
So we have a certain number of officers that we have what we call minimum shift coverage.
Yeah.
Well, once again, now all of a sudden, and sometimes you don't want to send one officer, especially if you have a female, then you get to two.
Mhm.
Now down two cops. So I really think that those are two big issues for me, is that I would like to have a mental health professional here in our building, and we could work out what days and what's, I think the first order of business, if you think that you could sell that to somebody, I'd ask Chief Dorst to get a hold of Chief Gerasi, the city of Newburgh. He's got to be having the same problems that we're having if we're that high. I had no idea that they were as high as we were, and I had no idea we were one. I knew we do a lot of frequent flyers, the same people over and over. And one girl runs around with a shirt on, T-shirt, and the Windsor police suck. I mean, we're there probably 2 or 3 times a month with her.
Mhm.
This other guy running around naked. I mean, this is some serious, serious issues that I really think that the statistics are great, but I'm telling you from my experience, I've been around the block a few times in law enforcement, something is going to happen. And when it happens, it's always a mother crying.
Mhm.
I've tried to get help from my son. I tried to have, and the other one is all of a sudden the poor cop is ready to put him on a stake and burn him or her. When this person has been known to all of us that there's a problem. But now this officer is stuck with this problem, probably by himself in the middle of nowhere, and God knows what's going on. But it happens all over the place. It's just a matter of time. If we're that high, it's going to happen here. Right? And what I'm trying to do is put it on record that I'm telling you that we need to do something about it. I'm willing to do our part,
Mhm.
but I think that the county needs to do their part. It's nice to gather statistic and all of this other nonsense. I've seen that. We get whiteboards, we chalk, we write this. I'm talking about when the pedal meets the metal, this is the officer by himself or herself with a person who is violent and mentally ill. Not a very good recipe. It's a recipe for disaster. So that has always concerned me. I spent a lot of time with the chief talking about these things. And we're always concerned about our officer and the person. I mean, listen, they're mentally ill, I get that. But we need to kind of go a step further than we're going. And I'm willing to go that step further. I'm willing to take it to my board and pony up our share to do what I'm really personally only concerned with New Windsor. I really need to tell you that. I could care less what goes on everywhere else, but I'm very
Understood.
concerned about this 38 square miles that I am personally responsible for. So I really am willing to put up some money and get this person in-house. And we know that it works in other things because we had the same issue with domestic violence.
Mhm.
That was, what's her name, Kellyanne, was it?
Yeah, Kellyanne.
I had her in here, and we sat down, and we kind of met for a while. The chief then made this happen where we had the person in-house, and it worked. And I would see that person here, and I think the officers were, sometimes you get out of your comfort zone as a police officer. You do all the training in the world you want, but their job is providing safety for people and protect and serve, not treating the mentally ill. Right? That's really not their job. And they do that here more than I would wish that they would do it. Because to me, that is always a recipe for disaster. So that's my pitch. We are willing to kind of pony up our share. I think he has a very good relationship with Chief Gerasi. We've had him here the other day. We try to do different things with him. So I'm sure he has having the same problem. Whether or not they'll pony up the money is another issue, but I think the county or your department can pony up a third. So I'm looking at a third. If it's 100,000, then I'll come up with 30 grand. If it's 120, I'll come up with 40 grand. But to get the person, and it could be a model to see if it works. You know? So that's just my reading what's going on. But a lot of these things, it sounds like we're going to do, but then when you find out that there's a guy who's at a special needs school, that's really over the top. And I kind of worried, they were very upset out there. They called the police, obviously they called me, you know, what's going on. And then it turns out that he had been over the Marine detachment over there, naked. I mean, poor guy's probably a mess, but he'll run into somebody. If you have a kid at that school and you see a guy running around naked and you happen to be armed, God knows what's going to happen, right? But then when they release him, he's back to the airport and the troopers are dealing with him wandering around the terminal. I think he was dressed, wasn't he? He was dressed. Thank God he was dressed. So that's...
Yeah, I think that was the week right before I was out on leave, and I think that happened like the week before I came back. So I was hearing a little bit of that. I hear you. I want to say a couple of things. One is, you know, the biggest challenge for us is that there are a lot of issues that get in the way, right? Willingness, typically mental health treatment is voluntary, so is substance abuse treatment. That makes it very challenging for any of us to do this work, but even for us on the clinical side. Um, they have to rise to a level, and this individual certainly should have. We argued that point, because he's running around, you know, the neighborhood naked, and there were other symptoms that we said were clear. One of the challenges, I think, is that we know statistically, and I know this is a data thing, but I have to say it by history, and this is years and years of history, most people that have a mental illness are not violent, right? And in some ways that justifies exactly what you're saying. Why don't you have more peer services or mental health services? Actually, they're more known to be victimized. You know, when people are psychotic or on drugs, there's a little different process that's going on with them, and, you know, puts them and others more at risk too. So we're open, you know, to discussion. I think one of the things that we talked about or mentioned was that there are some American Rescue funds that came into the county, that the county is trying to decide what to do with. I share that all with you. You have different ears than we do at times. But one of the things that we had proposed is doing additional CIT training or having additional supports around CIT, because that's one small piece that those monies can be used for. In the past, we've worked with Westchester Medical, for example, where we were able to leverage about $100,000. It's another example. So, you know, to do some additional training and support. So we're open to that. I will say that I know Fearless has had a lot of co-located models throughout the county, not just with New Windsor. The mental health / police model is kind of, not everybody's on board with that model. So when we look at peers, it wouldn't be a clinician that you would have there, right? Kellyanne typically has people that specializes in domestic violence, understandably so. We have clinicians and we have peers. So we would be looking at a peer to maximize something like that. But again, you know, whatever we can do to help support that. You know, at one point, I think with City of Newburgh, we applied for some of this funding and they were turned down for exactly this model to have in-house. So we've been trying to do that in the larger communities throughout the county in tandem with the Chiefs Association, you know, based on their input. Town of Walk Hill just came on board as a CIT department. I think that they're probably gonna, you know, battle you guys for number one. They're a pretty busy community too for different reasons. I will just share this with you. On average, what we get weekly from those 10 departments that are participating in CIT is we get between 20 and 30 CIT reports a week, just to give you a frame of reference. So it might be 5 from New Windsor, 3 from Town of Chester, 4 from City of Newburgh, none from Walden. You know, it varies. The other thing, just as a side comment, is March. I don't know about history with police officers or police departments, but I will tell you that March inherently is like the busiest month. It always tends to bring in more behavior referrals, more referrals in general for kids and adults on the mental health and substance abuse side. So it's an interesting statistic, especially when I heard you share, Chief, about, you know, the numbers that you have already to date, and just for the last couple of weeks, for the last month or so. So, you know, if that's the pathway you guys want to go down, we'll absolutely, you know, continue to explore that with you and look at what's available. We don't have extra funding. Basically, we ask what's needed and then we try to find the funding that's needed to support that. So if the peer is the pathway that you guys want to continue to explore, we'll certainly look at that. Typically, those peers we contract through an agency, just so you know, they're not necessarily hired under us. So that's just an FYI, and we go through a contractual agency in Orange County. The one that we use the most is Independent Living. They staff all the peers at the Orange County Crisis Call Center. We have peers that are in mental health courts in Newburgh, Port Jervis, Middletown, that are all Independent Living staff. So just as some backdrop.
Are they qualified or have credentials, or what am I looking at up here?
Yeah, that's a really good question. So like I said, they're not clinicians, but they are they are required to have a state certification as a peer professional. So They need to have lived experience. This is somewhat new nationally, although we've been doing it for a while. The certification is only a few years old. So they have to have so much education, so much training or lived experience. Then they have to go through the certification process, which requires letters of recommendation, references, things like that before they can even sit for the state test.
Okay, so listen, maybe I'll have the chief get a hold of Gerasi and Newburgh, see if they would be interested. Need be, I'll call Torrance Harvey too.
Sure,
And
absolutely.
reach back out to you, and let's at least have some discussion about this, because
Yeah.
I think police officers really, I don't care what anybody, not trained in this kind of stuff. It's not what they do.
Yeah,
Having done it myself for a long time, you deal with what you have to deal when you show up. You get out of the car, you're gonna deal with it. You're gonna take care of it. But it's not anything that really, I think that we have the expertise to deal with. You know what I mean? We do the best,
Yeah.
they do the best they can, as every police officer, I think, does the best he or she can. But if you don't have the qualifications, then sometimes the thing goes askew. People get nervous, people misread whoever they're dealing with, and that's what I'm talking about. Somebody's gonna get killed. Happens all the time, and it's the same story. I don't care whether they're white, black, rich, poor, it's the same story. Oh, I've been talking to people, I've called, I've had them there, and no one's listening to me, no one pays attention, and now we have this. And then on the other side is the cop. Everybody wants to get the policeman, who's just trying to do his job. So,
Yeah,
I think
we
we'll
hear
try
you.
that.
Absolutely. City of Newburgh has had that happen right next door to us, so
Yeah.
that's not unique, absolutely. You're 100%.
All right, so we're gonna kind of pursue this. We don't just talk about things here, we do things. No, seriously, you have to know.
Yeah.
When we begin to talk about something, we put things in play, we meet, we talk about it, we find out it's a budget issue, and I go to board, we kind of usually, if it's sensible, they go along with it. And we have a $43 million budget, so could I come up with 40,000? Probably. I think the county's probably 300 or 400,000. Could they come up? Yeah, they come up. So, okay.
Yeah, well, it might be, I mean, if you bring City of Newburgh into the fold, it would be interesting because with the new chief and now the commissioner, I don't know them, but because we've been working with them just as long as New Windsor, when we started CIT, it might be an interesting pilot to look at a halftime peer in your jurisdiction and a halftime peer in their jurisdiction. I have some thoughts about that, so.
The sheriff person.
Yeah, that's what I'm talking about.
Get a
Yeah.
full-time person that we get to know, that gets to know us. Go there, we deal with the city of Newburgh. The chief is very friendly with the commissioner and in particular the police chief. We've had him in here, I've met with them. It's not like we don't know them. I know Harvey well. It's not like, we know these people, so we can talk to them. And listen, we know the problems that they're having, and they know the problems that we have. And like I said, we have tried to do things with them. Sometimes it works, sometimes it doesn't, but we have a very good relationship with them, and there's no fences here. You walk across the street in the city of Newburgh, you walk across the street in Windsor. So we have a lot of the same problems that they have, and they have a lot of problems that we have. So we will definitely pursue this and see where we're going. I'm not sure about a peer, I'm still stuck on a clinician type person, but we'll definitely want to pursue this.
Yeah, and we'll continue. I mean, one of the things we're looking at the MOU, we're looking at some of the data around that, drilling that down a little bit more, so that we have a better grasp on what I might call a high risk list. Although we review high risk cases every week, like I said, we don't always know unless it rises to, a different level. So, I understand that the need to write a report on everybody because that brings it to our attention. One of the other things that Chris does, which I see in other departments too, is he'll put in his reports. And this may be, under your directive, chief, but this is the third time, fourth time, whatever. And I know we were talking about what's the threshold when we met. I can tell you that to rise to that higher level of intervention, you need to have a minimum of 2 hospitalizations within, I think, a 15-month period. That's actual hospitalizations. And then you need to have some, safety concerns that are documented in the community. A little bit of the challenges that there with bail reform, we don't have people coming in and out of the jail system the way they used to, so that kind of hampers that a little bit. But it doesn't mean that we can't do interventions, because we certainly do that before. So if I leave you with one thing tonight, I would say, everybody has my number in this world that I do work with. Certainly Darcy's always available. If there's an individual that you see struggling and you feel like something's not working, pick up the phone and let us know. Let's start with that and make sure that we're aware. And I think the officers already really do that.
Okay, thank you.
All right, thank you, Tammy.
You're welcome.
Okay, we want to move on here?
And you don't feel you have to stick around, Tammy, if you.
Oh, okay. Are you guys really meeting until 10 o'clock?
No.
Don't say that.
We're at our 60-minute limit right now.
All right. Well, let me know if you need anything, and thank you, everybody. Have a good night.
Absolutely. We'll be in touch. Thank you.
Okay, sounds good.
So I hope that was helpful to kind of understand their aspects as well. So move on, a couple more items on the agenda here. National Night Out, that's being planned as we speak. The date is fixed, which it always is on the same date every year, August 2nd, Tuesday. This is the first time New Windsor's done it on a town-wide level. We've done it for a community here and there, development here and there, each year, but never one location for the whole town. So that's what we're moving toward. This was set up by Supervisor Myers, Councilwoman Lincoln, and myself. And what we're looking at is some family fun, rock climbing walls, bounce houses, first responder field games, so like kickball and stuff with the police officers, canine demonstrations with our canine officer. There'll be some fire trucks there, hot dogs, hamburgers, ice cream, stuff like that. We'll have our tent set up like we do on Community Day with our police car, our bicycle unit, our motorcycles, and plenty of officers around to talk to the kids and to the families. We've also invited the state police. They'll be there. They'll have some troopers there, a troop car. They're also bringing their armored vehicle to have displayed, just I want to have people be interested. So we have the fire departments coming and things like that. So it should be really a good time. It's from 5 p.m. to 8 p.m. on the 2nd of August at Christie Babcock Park. So if you guys can advertise that out in the community for us, we greatly appreciate it. It's on our Facebook, our Instagram, and things like that already. But we're very excited about it. I know the guys and girls at the department as well.
Yeah, find the bikes come.
Yeah, so we have a community member here. Business owner owns Referral International across Temple Hill Road here from the police department. They're very generous. They're actually going to be donating to Trek branded bicycles to the National Night Out to be donated out to children. So there'll be 2 children's bikes. And the same individuals there, Mario, is going to also be donating 2 more bikes, same Trek bikes, for Community Day as well. So we're very lucky to do that. We'll run a little raffle for the children, and two lucky kids will be walking away with 2 really good bikes. So we're very lucky to have that going on too. So, and we're still planning this. We got Matt Veronese from the rec department, who's an expert at all this. So it's going to be a great night. I hope we get a really good turnout. We'll see. We're expecting hopefully upwards of maybe even 1,000 people. So we'll see how it turns out. New Windsor knows how to do this. Just an update on the ride along. So I put that message out. We kind of talked about it last meeting. So I had responses from Mr. O'Malley, Councilwoman Santiago, Mr. Hubbard, Syria, Briscoe Perez, and Neil Fernandez that were interested in doing the ride alongs. So we looked into it with our legal department, and we looked into it with our underwriters, our insurance policies and things, and it doesn't look like we're going to be able to do it, just because of the liability factors and things. So that was our feedback from the insurance company. So unfortunately, as it stands right now, we don't think we're going to be doing it. We'll move on to the use of force reports. So I emailed everybody on the panel the exact report I got from my lieutenant, who goes over these statistics, who does our accreditation, Lieutenant Valeri, of all of our use of force from 2021. So obviously everybody on the panel has had time to review that. I just want to touch on a couple things. I don't need to go over the whole form, but I do want to touch on some things. So you saw last year we had over 16,000 calls for service for the police department. We had a total of 568 arrests. So if you break that down in terms of use of force, so the contacts we made where force was used. So out of all the calls that we went to, only 0.134 of those calls force was used. Extremely low number, less than 1%, right? And the number of times the percentage of times force was used on an arrest. So this is a arrest situation. It's 3.8%. So also a very low number. When you look at 568 times, only 3% of those, about 22 incidents were force was used. So the state, so we're required now, as of around 2020, to upload use of force statistics to the state. We have 30 days to do it. So if we use force at any point, even if we don't, we still report 0. Use of force, say in March, we have the month of April to get that information into the state. The state's threshold for the use of force is lower than ours. That's why you'll see on our document here, we have 22 incidents where force was used with our internal policy, and we only had to let the State Department of Correctional Services know, the State Criminal Justice Services, only 9 of our uses of force met their standard, because it's lower than ours. And anybody can go on our town website, go to the police department main page, and our use of force policy is there for anybody to look at, review, print, do anything you want with it. And so I think those are pretty impressive numbers. To break them down even further, so the state standard is even brandishing. So if I pull out a taser and point it at somebody, not use it, simply take it out and point it, that's called brandishing it, pointing it at somebody, and that's the use of force to the state standard. We didn't used to count that as our standard here, but now we do, because now we have to track it. So even something as simple, of those 22 incidences, something as simple as taking a taser out, pointing at somebody, they then begin to comply, no further force is used, the taser's holstered up, and that's it, that's use of force in stateside. One of the biggest things anytime we put hands on someone and then we're not talking about escorting them maybe down a hallway or something like that, where we have to use hands-on to get somebody into handcuffs or something like that, beyond just helping their arms around to the back, that's a use of force for us. It's not for the state. So anytime we go hands-on, we document it, we want to look at it, we want to review it, the sergeant reviews it, and we're including body camera footage and everything. It goes to the Lieutenant Valeri to review, and then it goes to me to review. So there's many levels of review for every use of force that we do here. All 22 of these incidents had that, including the 9 that met the state criteria. So if you break it down, I thought it was interesting. So just to kind of in summary, what the state is looking for us to report monthly, any of our tools on our tool belt, as far as a taser, baton, our pistol, and if they ever brandished at a person, we have to report that to the state as a use of force. If we used any of those items, you'll see we had 1 taser usage. So that would be as an example of a usage. We reported that to the state. And they want to know about any injuries to individuals that force is being used against. They don't care about the injuries to any police officers. They only want the injuries to the people that have the force being used against them. And they want to know race data and age data, whether it be for the person that's the force is being used against in defense of for the police officer, and they want to know those statistics also for the police officer. So we'll wrap this up basically. So you'll see 22 instances of use of force. We had 1 police officer injured, only 1 officer, which is good. Minor scratches, and they were treated at the scene by EMS. We had 2 people that were ultimately arrested, so we'll call them defendants in this case, were injured. So 2 defendants injured all of last year during an arrest. And those injuries specifically were a minor scrape to the face, and that person refused medical attention. And the second one was a minor abrasion to the face, treated at the scene by EMS. So, again, no broken bones or anything like that. As far as what force we used in all of 2021, you'll see no pepper spray brandished, no baton used, no baton brandished, 1 taser usage, 5 tasers brandished, so they were pointed at somebody 5 times. Hands on, again, getting that person to comply to be taken under arrest 12 times. No canine apprehensions and no firearms being used. We break it down by race, as you saw, time of day. That's always good to know, time of day. And we had firearm brandished, I failed to mention because it was on the second page, 6 times. So there were 6 occasions where the police officers took out their firearms and pointed them at somebody. I think we saw at least one of those or more, maybe even more in the videos from the last meeting, and you saw that they were obviously justified in those occasions. So So I wanted to be, obviously, we're probably gonna end up putting this report up online for anybody to see. There's nothing to hide here. But again, it's open to the panel if anybody wants to talk about anything on here or has any questions. Officer Pierce is not included in there.
It's not always gonna be so clean. The nature of the business is that sometimes you get hurt and sometimes you hurt to accomplish your job. So we're very fortunate, but we could be here at the next meeting and have 6 things. You know, it's the nature of the beast.
I was thinking the same thing, and what I'll say to that is, this is good, highly trained police officers, and this is the community helping us behaving and following the laws. And as the supervisor said, if we simply had a bank robbery in 2021, where the individuals came out with firearms in their hands and began shooting at the police, these numbers would be completely different. But again, that wasn't, we need the community support to have these numbers this low. We apparently do have that support, at least in 2021. So to your point.
Yeah, no doubt. Sometimes you're fortunate, you know what I mean? Sometimes, like I say, it's the nature of the beast. You know, sometimes you can get hurt, sometimes you have to hurt someone. We've been lucky. Well, we almost had, what was that kid's name there on 32, what the city? Hurley, right?
Yeah.
That was right? That was a nonsense stop. Next thing you know, he's fighting for his life. So we'll never know.
Any other comments? Anything anybody wants to talk about on there? And that brings us to, right here, our final thing. So the body camera video. So I furnished to the panel, again, reviewing from last meeting. The panel asked for anything where there was maybe a training issue in a body cam video or anything we needed to address as supervisors or trainers. And I put a message out right after the meeting to the sergeant to please, forward us if we're not aware of something. We did have one instance that we were able to find. We weren't able, actually, honestly, to find anything else. I'm not saying we're perfect in any regard, but we didn't have any other videos to furnish. So we had one incident, this one call, and there was several things I think I could point out in regards. So basically what it was, the police officer, who we're not going to mention his name, responded to a call during the day to a local house here in New Windsor. And basically the situation was the people, it was their first day at the house. They pull up to the house after they had just bought it, and the driveway is completely full of essentially, I'll say not trash, but like old furniture and things like that. Long story short, that new homeowner had called the old homeowner. They had a company come in, clean out the contents of the house for them. They were supposed to bring it over to the dump. There was some sort of question with payment. That contractor then went back to the house and dumped the stuff back in the driveway, maybe perhaps thinking it was still the other person's house. I don't know. The new people show up and find that. So that's kind of in summary what had happened. You got to see there was 4 video clips. The officer's initial response there, he shuts the camera off, turns it back on, finishes his first talk with the new homeowner, gathers some information. The next 2 videos, video number 3 and 4, as they were labeled for you all, were the following day. Officer goes back, everything's been picked up, but now there's some damage to the driveway, documents that. And then the 4th clip was when he is back at the station here, and he is actually talking to the person that owns I don't know if it was a moving company or trash company, whatever, that had dumped the material on the driveway, and he was speaking to them, that person, that individual in the police lobby. So in summary, that's what the video was about, just for anybody watching. I challenged the panel to watch it for yourselves. I didn't say what was wrong or anything like that. See if you could find anything. We had some feedback from the panel, certainly. I'll say my quick spiel, and then if anybody wants to say
Did you found
anything.
something wrong?
Yeah,
I thought he did a good job.
there was some.
I did, I don't know. He said, somebody said on the phone, call the police. And someone, I think the woman says, no, don't call the police. And your guy goes, pretty good, right? He's gonna find out that and he did. Yeah. That's part of the video. Let me write this down. All right, but you're gonna tell me what he did.
So the homeowner was trying to work it out with the old homeowner, so there was a lot going on. But a couple things, so I kind of challenged the panel with if they could figure out what policy violations had happened and whatever, maybe procedural, criminally even though this was a criminal act, it was more of a town offense. That would ultimately be an appearance ticket. And if you could find anything. So there were some things, some of the things certainly that Mr. O'Malley brought up, were kind of secondary, I'll say, because perhaps you didn't know like the first 90 seconds. Some of the videos we've given to the panel, we removed that just because speed it up. This one we didn't because we wanted to show when the camera was activated. So the first 90 seconds of each of those 4 videos showed just the video with no sound. And that's the way it is. Until the officer activates it, there is no sound recording. But it always retains that last 90 seconds in case they turn it on late. At least you can see what happened, can't hear in case it was a personal conversation, something like that. So one of the things you could hopefully have picked up on was the officer, when he activated the camera to activate the sound recording, was late in doing that. And he was late on many occasions. So that's one of the things that essentially would violate our policy here, is they're supposed to activate it. You know, say, so he's coming out to talk to the individual in the lobby, he should activate that camera to be on and recording. And here's one now. He would double tap this button here real quickly, boom, boom, and then go into the lobby before the encounter with whoever that person happens to be, for whatever reason they happen to be here, start, so you have the entire conversation and the entire thing. You don't want to start it towards the middle. You saw like a lot of conversation back and forth was missed. Who knows what was said, what wasn't said. We don't want to leave those questions open to anybody's interpretation. Officer says this, the individual said this, we don't know what to do. We don't know how to decide if we get a complaint. You know, we want the entire thing covered.
So what is about like the approximate amount of time that you want them to have on? Obviously, before you walk up to the office, it should have been on, but are they given directions, like it should be, you know, within 3 seconds, within 5 seconds?
So we leave that open prior to the encounter. So for instance, that one, I would do it right before you open the door to go out there into the lobby. Because nothing's happening, there's a wall there. Activate it and then walk through the door and now let's go. Traffic stop, when do you do it then? Before you get out of the car.
Though, right? I mean, when they tap it, it goes back like 10 seconds or something.
It goes back 90 seconds, but just for video.
Oh, okay.
Okay, so again, if that person had again, they might have.
It might be in a situation where it's an emergency and you go, oh, and you got to hit it, so you want to have something.
Absolutely.
From prior to.
Yep, so that's why we have that pre-buffer going, and that continuously goes no matter what. And then if they never activate the double tap, all that gets erased. So we're not just recording them for their entire 8-hour shift. We're not looking to do that. We don't have the storage to do that. So that's important, and we have very little trouble with that, to be honest. I don't know what happened on this occasion. A little background about this officer. This officer was assigned to the midnight shift for the first, say, 3.5 years of his career after getting out of the police academy. This is a police officer we hired here. We put him through the academy, went through the field training program, and then went immediately on to the midnight shift. So that being said, I had concerns with some officers that had been on the midnight shift since the beginning of their careers. Ideally, what we would like to see is police officers get as much experience as they can in that first 2 years, first 3 years, first 4 years, as much as possible, because the more they see, the more they experience, the more knowledgeable they're going to be, the more they're going to have that information in their file bank in their brain to be able to pull that information out. On the midnight shift, it's not as busy. They don't get illegal dumping type complaints probably most of the time. They're dealing with drunk drivers. They're dealing with certain types of domestics and things that come in on those overnight hours in the middle of the night. So they don't have that wide assortment that someone in the afternoon shift would have, who are going call to call to call to call to call to call. So that experience takes longer to build up on the midnight shift. So I always try to get the police officers off of that shift to get that experience because it's so vital for their career.
So does it mean no officers begin with the midnight shift?
Well, for the first, while they're on probation, I control their schedule. Okay, so he bounced around a little bit in field training and things like that. Once he's off probation, the contract says that they have, this is the work schedule that police officers do. They go by seniority, and he may have very well ended up on that shift against his will. It depends. I think it depends on the year. Who wants to go where? The police officers decide.
Is it probation a year or 18 months?
His would have been 18 months, 6 months would have been in the academy,
Okay.
and then a year after that. So the limited experience. He had just been moved, actually. This happened on January 16th, you saw. He had just moved to the B line, which is the day shift, in January. So this was very early on, and we were keeping an eye on. Actually, it was one of my lieutenants who actually caught that even before this was all went into approval by the sergeant, the lieutenant had already picked up on it, doing a great job. So that was one of the things. So there was some issues with the cameras being turned on and activated. I think you saw probably a couple occasions where he was on his personal cell phone. One occasion was when he was speaking with the new homeowner. He was on his personal cell phone and handling personal business. That's something we definitely frown upon. You know, you call a police officer to your house, whether it's an illegal dumping or you just had a serious matter happen at your house, you want that officer's full undivided attention. They're professionals. They do not need to be handling text messaging and phone calls or anything like that. That stuff waits. So we had a little bit of a problem with that.
I don't think I would have known if it was his phone or your phone.
Yes,
Right,
I would
I thought the same thing.
Neither did I.
Like, was letting somebody know back, you know, there was a police on here.
Oh, no, you may not know that, but we know that when we see it. And they're not supposed to be doing it. You know, so we pick up on that right away. And that's those set of eyes that have the experience with, what is this? What is he doing? You know,
Do they have cell phones and the radio, or just the radio?
they have a radio and their personal cell phone.
Not a department cell phone?
No,
I didn't know.
New York City does.
every New York City police officer, to my knowledge, has
Yeah,
a
they give
second
my
phone. So that was another thing. He kind of, if you saw, the whole encounter is supposed to be body camera, right? So you saw him at one point turn away, then he came back, and then he activated it late when he came back to re-talk to the person. At one point, he goes back to the car to run a driver's license or something. And that's not recorded at all, so God knows what was said or done there. That should all be recorded on one continuous recording until he leaves, gets back in his car, shuts the door, and drives away. Then you shut it off. That's what we want to see, because you can see how that, simply doing that is going to eliminate a lot of he said, she said, and complaints. Or if we have to follow up with the case, or the district attorney wants to look at it, those answers are there. You know, there's no questions. What was said there? There was no sound. Or why isn't there camera video of him saying this, but it's in his report that he did this? Did he do it? It's not, you know, so it eliminates all that kind of stuff. So we definitely want to see that. There were some questions. So some questions in regards to some information that we took from the moving man in the police lobby when they were giving him an appearance ticket, when the officer was giving him an appearance ticket. A lot of that is covered by this pedigree information. So you're allowed to obtain social security information. And again, he can refuse, but it has been through the courts where they're allowed to get his home address, his height, his weight, where were you born, those kind of things. So just so we're clear, we get that information for pedigree. So for background information and for arrest purposes, like just like you would take someone's fingerprints, this wasn't a fingerprintable offense, or take a photograph. Again, this gentleman, very low level offense, and just got an appearance ticket. But we still gather their personal information. Should a bench warrant come out from the court, we would not only have his home address, but we would have where are you from, or where were you born, whatever the question was. We would know maybe to go back to say, oh, okay, this gentleman's from New Jersey. Maybe we could try to follow up for a warrant should that happen back there. That information is not used for anything other than that. It's not you. We've never investigated somebody for being a legal citizen or an immigration violation. We don't do that stuff here. That's not our job. His sole responsibility was this illegal dumping. That was it. So just so you understand.
I mean, the average citizen is not gonna know what they have to answer and what they don't have to.
Sure. Well, they technically are required to answer the pedigree information. So the height and the weight and the address, that's all part of the booking process. And they don't have to be Mirandized for that as well. That's all just pedigree, basic information.
Let's say he refuses. Is that the end of that we're gonna?
So he refuses. We've had occasions where people have refused to be fingerprinted and photographed. They end up getting charged with obstructing governmental administration. It's another program.
Would they be charged for that by not giving any pedigree information?
Yeah,
Yeah.
especially with the fingerprinting and photograph.
No.
This offense, we probably wouldn't have.
Yeah, that's what
We knew who he was. We had his name and everything. Wouldn't have been too big of a deal. And again, we don't necessarily want to make what's an offense for a town violation into now a crime, you know? So, but again, a lot of that just goes back to the officer's demeanor, the officer's professionalism in dealing with this gentleman. He had no problem. He understood the situation. He actually kind of says he's wrong at one point. So it kind of is what it is. And again, like
Well,
last year.
the guy was asking the officer questions also, like, about the court date, like, oh, how soon is the court, things And what do you think I should do? Like, things like that he was almost asking, he was considering the officer an advisor a little bit. You know, that's a lot, yeah.
You know an attorney? Anybody good I could call? You used to get that all.
Yeah, the officer had to explain why he gave the court the date that he did, and it had to be a certain amount of time out, and those kind of things. So sometimes that needs to be explained. So some of the other stuff, so he activated, he was on his cell phone. Another thing, so you saw him, so you have a gentleman that it looks like you're going to give an appearance to, you're going to be arresting him for a town offense, okay? One of the things we like to see, if you're going to start asking him questions, obviously you need to advise him of his constitutional rights. Did anybody hear any Miranda given to this gentleman? No. Right, so but again, the first part of, it wasn't long enough for Miranda, don't get me wrong.
Yeah.
The first part of that conversation wasn't recorded because he was late to the button. So was it given? Wasn't it given? I'm telling you it wasn't, but we don't want that doubt. It was necessary because he was asking him questions about that specific incident.
Okay.
So it would be required in that instance, unless he was just literally coming out, I'm going to write you an appearance ticket on information, boom, 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 here you go, appear in court on this date. He wouldn't have to use Miranda. But based on him questioning him, wanting to question him about that, he needs to be told that your constitutional rights, you don't have to answer anything I say. Or you can if you want to try to clarify this or whatever. You know, so just to clarify that. So, and then there was some paperwork. I don't need to get into all the paperwork. There was some paperwork missing. He should have taken a written statement from the victim. He maybe should have taken a written statement from the old owner about what had happened. He should have offered this gentleman that ended up getting the appearance ticket an opportunity to provide a written statement if he wanted to.
Yeah.
Right? He has rights to if he wants to provide a statement. So that was never really done. There were some technicality forms for the court that weren't done.
So when he went to the house, where would he have obtained the written statement?
He could have did it at the scene by hand, and Officer Pierce knows all this. He could have did it at the scene by hand, or he could have invited that new homeowner to the police station, and they could have went in the public complaint room downstairs, and the officer could type up that complaint, print it out, he'll give it to that person to review, make sure it's exactly right, exactly what you want to say, anything you want to add, anything you don't want in there. That person signs it, the officer signs it as a witness, and now you have more of a basis for that complaint moving forward with the court. Because all he had was like the verbal of the body camera to go by for the court. The judge isn't going to sit there and necessarily watch the body camera. He's going to want to read statements and make sure that that charge is fundamentally correct and fundamentally sound. And that's not necessarily through the use of body cam videos. It's written statements, sworn statements for the court, what they want.
I would think that would just, add time, right, to the call. I mean, if it has to be done, it has to be done, right? But, wow.
It's all about the time, especially every domestic we have. Not only do they have to go in our computer and when they get back and type it up and make sure all the pedigree information's in there, and who was involved, who was there, and who was notified. They have to do all that and then send it to the supervisor to be approved, but there's a state form that's multi-pages that they have to handwrite out at the scene. It's almost like duplicating services that eventually goes then to the state to go into the state data bank for reference. And they get copies of it. So it is very time consuming. Even in domestic where it's calm and maybe it's calmed down since the phone call was made, they're still there for a long time just doing procedures the way it is. So those were the major things I'll mention. So what did we do with this officer? You know, did he get in big trouble? What did we do with him, right? So what ultimately, I think, Ms. Bishop Perez kind of put it right. We were emailing back and forth. Ultimately, what does the police department want? We want this individual to learn and grow. That was the words of our educator. I think I think it sums it up, right? That's what we try to do. And that not only for this case, but for their entire career, these police officers are supposed to be learning, educating themselves more, growing, becoming better. You know, that's what we're looking for here. So what did we do? So in summary, I'll wrap it up. So what did we do? We had the officer rewrite the report more accurately to the best extent that he could, truthfully. We ended up dismissing that charge in the court because the case was not sound. It wasn't justified, it wasn't sound, so we dismissed those charges with the court on the interest of justice. The officer requested that of the court. We counseled the officer, so we retrained him in the matters that were lacking here. We counseled them on it, the sergeant talked to him, make sure those things couldn't happen again. And then I think one of the most important things we did was we put him, and again, there was more than just this one little incident here. We put this officer back in our field training program. So he had to ride with police officers who were trained to be field training officers too. And he basically did everything, and that field training officer would just observe. So if there was anything lacking or something like that, that field training officer would bring it to his attention and have him correct it before it got to the sergeant level thing. So he basically, the field training officer shadowed that officer for a period of about a month or so. And he's doing a great job now. We're still very proud of him. No issues with this officer, but this is just one instance where you could see a body camera really helped us ultimately at the end of the day become better.
Is there like a mentorship, program, especially for an officer who's new and who's training in the midnight shift? I'm wondering if there like a mentoring program where if he's being transitioned to a shift that's busier, like when he's going to, or she's going to be exposed to different days, would they be paired with a mentor?
Not necessarily. Ideally, what I would like to see, maybe some, again, this would be between the town and the PBA, maybe some changing in the wording of that to where maybe someone can't be on the midnight shift for the beginning of their career for many years, because it's not beneficial to the office. And it's not beneficial to the community as well, I don't feel. I think they need to move around a little bit and get that experience, especially in those first early years. We've seen it time and time again. Moving forward, when we have police officers come off the midnight shift, who were there the whole time like we're talking about pretty much, maybe it wouldn't be a bad idea to just initially team them up with a field training officer just to make sure on that busier shift that they're going to be okay. I think
There is a sergeant on every shift who is supposed to be monitoring all of his officers. So you could consider him the mentoring. If something's wrong, he's going to tell him. It's not the way we do it here. But I think what the chief is saying is, it's slow on the midnight, so I don't care where you are. Once you get to 2, 3 o'clock in the morning, you know. But the evening shift is very busy, and the day shift, you see a lot of stuff moving around. So I think that's what we'd rather see them there. Get that experience. And listen, sometimes at a midnight shift could be a horror show. More often than not, it's usually okay. And a lot of officers will know that, and that's what they go to. Usually quiet. And sometimes it's not quiet, but usually it's quiet. So the mentoring to me, and we have a sergeant on every shift, right? We talk about that all the time. So that's what he should be doing.
And ultimately, all the paperwork and everything goes back to the sergeant for approval. So he would have caught it, no doubt. But this one happened to get picked up even sooner than that. I think a lot of the calls as well, we're fortunate to have enough police officers here. There's a lot of communities that don't have enough police officers. We're at a point where we do. And a lot of these calls get more than one officer to respond. Maybe not this illegal dumping complaint necessarily, but most of the calls we're going on, there's more than one. So if there's a question or something ain't quite right, maybe with the paperwork, or, oh, hey, we should get a statement from our member. Oh, okay, no problem. So sometimes it's just that simple. And that's what that field training officer, he kind of bridged that gap for us when they wrote together for that period of time. And it's always good to have that second eye set of eyes there. So yeah, I think that's a great idea moving forward, but.
I might be naive also, but I thought there were some things that he did that I thought he did well.
Absolutely, there was a lot that, like
Yeah,
the
me too.
supervisor had said, he actually liked the call.
Yeah, no, I'm not attuned to the most of the things. Yeah, but to me, I think he did a good job, and he got the guy to clean it up, and the guy seemed remorseful today. He didn't get paid, and he really thought he should get paid more. So I'll be a jackass and dump all this back on the private. And as soon as he heard it, oh, listen, and then when he heard that it was her first day at the house, you could hear in his voice, oh my God, you know, how would you like that? So we did come out.
But the officer responded to that by saying, no, don't come with me down there, right?
Yeah.
I'll go down there and reassure them, blah, blah. I mean, that was a pretty insightful thing.
Yeah, right,
to
yeah,
do.
no, I thought so
Right.
too.
Yeah, he avoided a potential conflict down at the house, absolutely. You know, we're watching this video from the eyes of what was wrong and what we're correcting. But absolutely, there was a lot good with it too, but that we're kind of focused on right now on the other. But yeah, ultimately, he was professional, you know.
This
I
was
think
good, though,
ultimately
that he
the people
didn't turn
were
that on
happy
and off, that's a good training thing. You gotta
Absolutely.
do it right. You know, that, if that was, I didn't pick that up either, but that would be a training thing. Listen, make sure you put it on. Covers you, covers the person you're dealing with, and that's why we have it.
Mr. O'Malley, I agree, I thought he was very kind and so forth and worked well with everyone and spoke well, even telling the gentleman, who came in, he was asking for guidance what to wear, especially to the court date. So my question would be, so without the cameras, you said that he started to put stuff on the report. What showed on the report that was not correct? Or-
So you would notice that, so the sergeant's gonna get an envelope, a manila envelope like this with all the associated paperwork, parent ticket and everything. So he would have noticed those court forms that are required, the permission and authority form and things like that were not there. The
okay.
statement from the victim were not there. So he would certainly, and then he could read the report and say, hey, I'm wondering, probably should have done that. And that's frequent for a sergeant to do. He'll say, okay, he'll close it up and he won't approve it and he'll put a couple notes on it and it goes back into the box and they follow up. A lot of it could just be correct most of the time, right? Let's be real. Most of it, oh, I'll just go take a statement from the victim now, not a problem. This one, a little different, but most of them, it's not uncommon to get a report paper. They might miss a little. So, but absolutely every report, and not only just arrest, but every, domestic, mental health case, everything we do gets reviewed by the sergeant. And then some of them even go further than that. So there's always that duplication, of making sure we're doing the right thing.
And everything is done paper pencil, say paper pencil, but everything has to be written, nothing is done electronically. So for example, I know with COVID, we did a lot of our reporting, electronically, so if we needed a written statement, it was done electronically, not done on paper. Is there anything that?
We had some of those things in place for COVID, actually, where we would take some reports over the phone that we could, and we had it all written out for the officers done. We've rescinded that since then, with the numbers changing. But primarily, it is in person. It's just something like this, it's gonna have to be in person. Just that simple. I mean, there's really no way around it, unfortunately, because the court requires what the court requires. If it was gonna be simply a case, let's say they didn't want to have an appearance ticket issued, and officer, please just have somebody get this out of here, I don't care what happens, I just want it gone, and they were satisfied with that, and the officer was able to get that done, then it necessarily wouldn't have had to been any more paperwork than that. It would have been a simple blotter, contacted the individual that dumped the property, they came, removed it, owner was satisfied with those results, done. But this was at a different level for the appearance ticket. So I think that wraps up the agenda. We have the retirement for the deputy chief next Friday. If you all can make it, I sent you an email about that.
Thank you.
National Night Out. The award ceremony is coming up too. That's the last thing I wanted to mention. May 18th. It'll be out. It should be out, provided the weather is good, at Christie Babcock Park, May 18th. At 5:30 p.m. You will all get an invite in the mail, so don't necessarily worry about writing it down. But please, I think a lot of you were there last year, so we're obviously re-inviting you again this year. So we hope to be able to see you there, support you officers. On the whole time.
I'm gonna make a point. I don't know that I can watch people on their cell phone, he's one of them.
Leave the body cam.
Huh? Take his phone. All right, yeah, listen, I appreciate you guys coming out and thanking us, and being part of this panel that we put together. Obviously, Chief, you can see, takes this very seriously, what we do. And there's a lot of oversight of the officers, and by and large, we really don't have any serious problems. You have to get the DA all of this personnel complaints now, and I went over them with the chief, and I said, don't worry, wait till he gets the state police complaint. They won't even know we're alive. We don't really have anything that's of any substance, and we're just forceful. But tomorrow we could. It's the nature of that beast too. I mean, sometimes guys get off the rail, and that's why guys like this are in the position they're in. Bring them back. All right, thanks again.
Thank you.
Okay,
Very good, thank you.
Patrick, thank you.
Thanks, Pat.